Assessment of scapular abduction and upward rotation begins with the patient seated with hands in their lap. The patient raises their arm to approximately 130 degrees of flexion with the elbow extended. The scapula should upwardly rotate with the glenoid facing up and abduct without winging. The therapist provides resistance on the arm proximal to the elbow. The other hand palpates the edges of the scapula at the inferior angle and along the vertebral and axillary borders to assess motion.
Raise your arm forward over your head. Keep your elbow straight. Hold it. Don't let me push your arm down.
The Grade 2 test for scapular abduction and upward rotation begins with a patient seated with their arm flexed above 90 degrees. Support for the arm is provided at the patient's elbow. The therapist's other hand lightly grasps the inferior angle of the scapula to assess motion. The presence of scapular winging is monitored.
Hold your arm in this position. Now let it relax. Now hold your arm up again. Relax.
If the scapula does not abduct and upwardly rotate when the patient attempts to hold the arm in elevation, then the therapist palpates for a contraction of the serratus anterior along the axillary border of the inferior angle of the scapula. The patient attempts to hold their arm in the test position.
Try to hold your arm in this position.